Well, for years, he was known to America as Dr. Oz, host of the award-winning TV show, The Dr. Oz Show, which focused on health and wellness. Now, Dr. Mehmet Oz has taken on a new role, this time in Washington, D.C., as head of the Centers for Medicare and Medicaid Services.
All right, he's leading the largest agency under the Department of Health and Human Services, tasked with delivering health services for more than 160 million people with a budget of $1.7 trillion. Trillion. Dr. Oz in studio. Nice to have you back. How are they treating you in D.C.?
It's the best job you could ever imagine.
Really? There's a lot of pressure.
A lot of pressure, but you have remarkable talent, especially in what I do, which is to help run Medicare and Medicaid and the exchanges. You have a lot of folks who have real domain expertise. They know exactly how to calculate what the insurance rates should be. They understand the lever arms that make it more efficient or less effective. And you also have to play with the states. So if New York State, for example, is being pressured because they're spending so much money on health care that they can't pay for education or other social services, they often turn to the federal government. So you've got to figure out what's the best way to help the most number of people. And the main charge, I should say, is take care of the vulnerable Americans. That's the major goal of all of the different insurance programs that we offer.
Okay, so let's get to it, because the city controller, Brad Lander, has put out a report saying that 4 million New Yorkers will be affected by Medicaid cuts, and nearly 2 million New York City residents who receive SNAP benefits will also be affected. What are you doing with Medicaid in New York City?
Well, in every program that I've looked at, every model on Medicaid, we're actually spending more, not less. We're spending more money on Medicaid. The question is, how much more do you spend? So let's take a little overall look at this issue. Medicaid was designed initially for the most vulnerable members of the population. As you walk into our building, where Bobby Kennedy and I reside, at the Health and Human Services building, there's a little plaque from Hubert Humphrey. He was a Democratic senator when this entire process started. And the quote is very clear. It says, a moral government's obligation is to take care of those at the dawn of their life, those are the kids, and we cover about half the kids in the country through Medicare and Medicaid and CHIPS. Those are the twilight of their life, the seniors, and those living in the shadows. That's who the program's designed for. So when you add people onto the program who are able-bodied and able to work, then you actually created a potential risk, which is you've got to now pay for a lot more people, and the services get stretched out.
But how do you know that someone should be working and they're not just vulnerable? Because, you know, we've heard from the administration that over 1 million migrants are being covered on Medicaid, and, like, you know, kind of signaling those people are going to be cut because they should not be on Medicaid. I mean, how do you take them off Medicaid?
It's not about taking people off Medicaid. It's about giving them choice. Here's the opportunity. Now, here's the metaphor. You get home at night with Lou, and there's someone sitting on your couch in the basement. You don't know them, but they have health insurance that you're paying for. And you say, listen, to keep this health insurance, I want you to apply for a job. You don't have to work. Just apply for a job, go get an education, volunteer somewhere, be involved in the community, or take care of one of the kids in the family, help out a little bit. If they say no, you say, well, I'm taking your insurance away. That's not an unreasonable deal to make, and 80% of Americans think that's fair. So nobody wants to throw people off Medicaid. I want people who can and should be on Medicaid to remain there.
But some of those people are vulnerable because they're worried that if they do apply to work and they're not here legally, they could get deported.
Well, the illegal immigrants is a whole separate issue, Rosanna, but here's the question again. If New York or California are paying for illegal immigrants for their health insurance, and Mississippi and Alabama didn't ask for that, but they're paying the taxes that make the bill feasible, well, that's not fair to them either. So as a nation, we can decide we're going to cover illegal immigrants, but you can't have individual states going rogue and deciding to cover illegal immigrants and then passing the bill along to the other 48 states who decided they don't want to do that.
And so much of this obviously is tied to the reconciliation bill that's being discussed, the big beautiful bill that the House passed. Now the Senate has to take a look at it. Talking from Brad Lander, the controller here, he says that more than 55% of births in the city are covered by Medicaid. Yeah. How do these potential cuts that are involved in this bill affect people like that?
again, we're increasing expenditures on Medicaid. We're putting more money into Medicaid. It's only a matter of how much more money we're putting into Medicaid. Children are not going to be compromised because we're going to continue to cover children. They can't go get a job, right? We want to make sure there's enough money to cover children, to cover elderly who don't have much resources. Those are so-called dual eligible, where they're on Medicare and Medicaid. We want them covered. Folks who have disabilities, nothing's changing there. The question about work requirements, which is really community engagement requirements, is designed for able-bodied individuals who could enter the workforce. And here's the whole promise. You don't want generational poverty. You don't want a community where no one has ever had a job. So we're asking you, get off the couch, apply for a job. It turns out if you apply for a job, because we've got twice as many jobs as there are people looking for them, you'll get a job. So then now you move off the Medicaid rolls into the exchanges. We're going to fund the exchanges. So we have a crutch to get people off Medicaid into the exchanges and into commercial insurance. That's how America needs to function.
Democrats would say that it's not adding to it, it's cutting. There's cuts that are involved here. I mean, they're saying that these are money. This is money that will not be there down the road.
Mathematically, it doesn't matter Democrat, Republican, this is math. We are spending more money this year than last year on Medicaid. So it's an advertising ploy to call it a cut. The reality is you're spending more money. They want to spend even more money, but it's not solvent. My job is to preserve Medicaid so it's there for the next generation. If we bankrupt it by spending money we don't have on people we didn't decide to give it to, that causes a problem for the people that it's truly designed for, the most vulnerable.
So some people would say that these adjustments, however you want to describe it,
very well. Adjustments
are a moral choice in sort of how you approach this policy. How is your moral choice affecting your leadership now in this new job?
I'm very clear-sighted in these adjustments. I know my main goal is to ensure that people who are unable to get a job for whatever reason are protected, and folks who can get a job are given a choice and an opportunity to go get a job. It's better for them long term. Having purpose, having use in life is actually a positive contributor to your well-being. And as a physician, I'll speak to this. You know, if you don't think you matter, that whether you get a job or not, or show up for volunteer work or go get an education, doesn't matter because you're a nobody, that's a bad thing. I want you to feel like you have agency over your future.
That's the moral choice.
That's the moral choice I'm making. And 80% of Americans agree with me on this. And 80% of people watching this broadcast right now are looking up and saying, you know what, that's sort of sensible. And I wouldn't want someone sitting in my basement doing nothing all day long. I want them to get off and go do something because it's good for them too. Plus, we need the help in America. We need folks to do the jobs.
So when do you think those changes will take place?
Well, if the Senate passes the bill that was created in the House,
big beautiful bill,
the big beautiful bill, then by the middle of the summer we'll have this passed as part of reconciliation. But this is part of the story, Rosanna and Dan. We also need to actually reduce the amount of money we spend on health care by not spending things on things that don't matter. For example, the whole movement towards the most favored nation drug pricing is a very bold move by the president. The executive order says that we're not going to saddle Americans with bills on medications they can't afford to pay. This is a crazy number. 2/3 of all bankruptcies are caused by health issues, and 1/3 of people, when they get a prescription from their doctor, go to the pharmacy, don't fill it because they can't afford it. We're forcing Americans to choose between being healthy and being bankrupt. That's not a moral choice. So the president has said to the drug companies, and he's charged me with this initial foray, they can volunteer for now, but there's some levers we can use later on. You must give the prices that you're charging in other countries to the American people. 70% of all the profits of drug companies are made on the American populace. We're only 4% of the people in the world. That doesn't make sense. We're paying 3-4 times more for the exact same drug, same box, same manufacturing facility, 3 to 4 times more than they're paying in Europe. It doesn't make sense. So let them pay more, and we'll pay less. The president calls it equalization. We did it in other areas in the past. He's a great negotiator. We're going to make this happen.
Doctor, we're kind of running short on time, but since you're here, I will need to ask you about this because it's making headlines today. The Make America Healthy report, the one that came out, has been heavily criticized because it cited some non-existent medical studies that were out there. The White House has acknowledged it. Do you feel comfortable with this report shaping policy, knowing that there are these sort of big errors that happened here?
I'm unaware of that report, but I could say that the report, the texture of the report, what it's actually describing, is incredibly valid. And the bigger reality for all of us to focus on is that we are now a nation of chronic illness. And 70% of the entire budget of healthcare in America is driven by those chronic illnesses. Now, it didn't just come up by itself, so it's not, I don't think it's genetically driven. We didn't just change as a species. We have made it hard to be healthy in America. That's the real focus of the MAHA movement. But can I describe what MAHA means in one word? Curiosity. It's all about being interested in truly learning the answers to the questions we should be asking, like, why do we have so much autism? What's going on with chronic illness in America? Why do a third of kids have allergies and autoimmune problems? What's going down? So if we can start to answer those questions and truly are curious about them, and we're courageous enough to share what we learn with each other with a little bit of compassion, because people don't care what you know till they know that you care, we can actually get our country back on its feet again. The main way we will balance our healthcare budget in America is by becoming healthier. What's the best way to spend less money on medications? Use less of them. So let's get healthy as a people. The MAHA movement allows questions to be asked that historically could not be asked that comfortably. The MAHA moms want answers. We owe it to our families to give them some.
All right, well, congratulations on the new job. And congratulations, I hear your son is following in your footsteps?
So Oliver graduated from Columbia Medical School last week. So
Another Dr. Oz out in the
last bill
world.
was paid for tuition. The first thing he did when he got his diploma is he called my father-in-law, who's a doctor, and he said, "This is Dr. Oz calling."
Oh, that is great.
Congratulations.
Bless to both of you.
All right, keep us in your prayers and thoughts in D.C. All right, thank you, Dr. Oz.